Okay, so welcome back from your break. I hope that everybody online got a chance to stretch and folks in Old Crow and Dawson Hub got a chance to stretch. The keynote was fantastic. I really enjoyed that, and a good plug for YouTube Premium. So you don't get those ads, hey? I actually didn't notice it wasn't part of the video until I saw the keynote's space, and then I was like, yeah. So there'll be a quiz on that video later. No, I'm kidding. So we are going to move to our first panel on YSPOR challenges and opportunities. Our panelists have chosen to clump boys and girls. They were invited to sit wherever they wanted, but that's okay. And hence, nobody beside me. I'm a little hurt. It'll be fine. I can stand up with you, so thank you. I'm good. I'll sit. I know you guys can talk. This is a fantastic panel, and I'm really, really, really looking forward to it. I'm just going to really briefly introduce our panelists because you have their bios in your package. Our first panelist is Elder Jerry Soltini. She's an Athabascan Tlingit woman. And I'll tell you, one of my favorite elders, when I walk into a room and I see Jerry there, I instantly feel better. She has this way about her, and she's one of the elders that when I know I've done wrong, man, she's got that perfect auntie look. I love you, but. And that's fantastic. Our next panelist is Mathia Alatini, a proud KFM member and my older cousin. Thank you. She's a bit feisty already today, so I had to throw that in there. Mathia works on everything. I can't keep up with all of the different projects Mathia's on. And I'm really excited to hear her perspectives about health research in the Yukon. Our next panelist is Jason Bilski. Nope, I lied. He's at the end. Aha! Tricked me already. Our next panelist is Dr. Ranadad, who is currently the Chief Medical Officer of Health for the Yukon Territory, and I'll tell you, has a very, very comfy-looking winter jacket. If you saw him, he's definitely prepared for the winter. It looked great. And he holds certification of family medicine, public health, and preventative medicine. So that sounds like a lot of very important certifications to hold. Great. I don't really know what those mean, but we'll find out. Our final panelist is Jason Bilski. He's one of my favorite finance guys, has a background in financial stuff, all of those important considerations. Also known for running our hospital corporation, and I have the honor of sitting on a board with Jason, and is probably one of the humans that I think is most responsible for some of the exciting changes and leading some of the changes that are coming in healthcare. So let's just jump right into it, shall we? I like to keep panels on their toes. I don't know if anybody warned you about that. It's going to be fun. Davita's also got a sticky over there, so if we run out of time, she's going to start flashing us sticky numbers. Perfect. Okay. So our first question I'm going to ask Mathia, and then I'm hoping that Elder Jerry will jump in on. But can you share with us how YSPOR has successfully taken a Northern and Indigenous approach to their work? I'll counter that with, you can also point out areas for improvement.
Thanks for adding that. I said, why are you giving me the success story? I'm much more of a critic. I really am honored to be here, first off. Thank you for attending and for all the work that you do in health and health research, because you're here because you're interested in helping our communities. And I was really inspired by the keynote address this morning and the work that is being done in our neighboring communities in British Columbia. I think that YSPOR and the work or the network that is being built, I feel like it's still at its infancy. It's the initiation of conversations. It's the bringing together of people in these types of rooms that really change how the conversations flow. And when you hear the work and the results of the work that was done in British Columbia, it really is from that perspective of building relationships and having the conversations. So what are the challenges in our community and how are we facing those? Because we're a small community. When you look at the Yukon as a network with 48, I think that's our latest stat, 48,000 people in the entire territory, how are we working together as a territory to address these things? And it is through these types of conversations. So I think YSPOR has done a great job of bringing together these networks and is looking at incubating the the champions in community that need to be the hosts of these types of conversations to really funnel in what type of challenges we're facing. How are we looking at these things, and how are we addressing these solution or challenges with community-based solutions? And it really is through those conversations. So I think that is the one of the biggest initial successes, and I think that's the thing that we have to really nurture and support in order to continue to have success. The other kind of piece that I really think that is a success is bringing in people with lived experience. I know one of the initial or one of the strategies is to build more of those networks for YSPOR, and I think that is bringing in those kind of community voices. Who has the experience? What do you know that has the challenges and has overcome the challenges? That kind of experience or knowledge is game-changing when it's coming to solutions. And I think we heard that when we were listening to the opioid discussion is, do you have people with lived experience? Because you need people who can understand and empathize and have some level of EQ to deal with these health challenges.
Great. Thanks, Smithia. Good start. Elder Jerry?
Yagiyuk Satini, it's good to see all of you here this morning. Thank you, Mattia, for that very generous response to the first question. I think for an elder, it has been very important for me that YSPOR has made considerable effort to include elders and youth. I've had an opportunity this summer to work with 2 different projects with youth, and I am glad to see that we are able to pass our knowledge to the youth, and in turn, they're able to learn from us how to help their people in their own communities or even the rest of us. So I'm just very happy to be working with this YSPOR unit, and happy to see, despite the fact that they're new, how quickly they are advancing.
Chief Elder, thank you for that. Gentlemen, anything that you want to jump in and add on that question?
Yeah, quickly, and I don't want to be redundant to what's being said here because those are great responses. I think it's extremely important, and I can acknowledge that, YSPOR has taken the approach that they're very partnership-oriented and alive to the sensitivities in the communities, and that has been right from the get-go. And you can use all the buzzwords: inform, consult, involve, collaborate. But I can see the people in YSPOR have taken this to heart. So, I would like to extend a bit of gratitude and kudos to people like Bronwyn, like Michelle, and Shannon, and others, not just for this today, but right from the inception of YSPOR, because it has been a challenge, bringing this off the ground, and it's taken some time and involving different partners. Other things I would like to add, and this is similar to what Elder Jerry has said. My observation is the engagement of youth and engagement of elders and engagement of First Nations. People like Elder Ann and Elder Jerry provide that richness of knowledge and richness in just being, I think, that brings forward what YSPOR is all about. And then again, targeting those projects that are relevant to communities and relevant to First Nations has been important from the beginning, I think, and that's what will keep it, I think, relevant and important going forward. And lastly, I'd like to say, Davida, you didn't tell me that Tosh was moderating this, so, I felt okay coming up here, but now I'm a little scared. I'm still excited, but a little scared. Thank you, Tosh.
I love that. You should be scared. In that vein, the next question's for Jason to lead. But I just want to see if, Doctor, you had anything you wanted to add to the first one before I jump to the next. Sure.
I think one of the things I would say in terms of of successes, and like I felt it in sort of the way that we've gone about doing some of the YSPOR work. Like I feel like there's this really strong willingness in the YSPOR group and community to like check in and go sort of, you know, are we doing this in the right way? Is it working for people? So one of the recent advisory meetings that we had, we actually stopped and said, okay, instead of taking anything that we have on this agenda, let's actually go back and say, are these meetings working in the way that they're structured? Are they doing the things that they need to do for the people who are here? And because we were able to do that at the advisory group level, I think that that speaks well for what YSPOR is going to be able to do at the population level, at the community level. So I think that I would just add that like attention to like doing, you know, the, attention to the path and the way of doing things.
Great. Yeah, I agree with all the comments made. I think it's also reflective of YSPOR's success that we have the number of people from communities in the room and joining online. You're talking about incredibly busy people. Anytime I get to see Jill and her team, it's a miracle because they're always flat out on the ground. So the fact that they're giving up 2 days and coming in and joining us online, I think is also a measure of success. I should mention that we did unfortunately have a couple of people who were going to join us both for the panel and for other events throughout the day, specifically with that lived experience that Mathia was talking about. And get ready for a deep thought from Tosh Southwick. COVID sucks. And unfortunately, we've had a number of people, poor Shayna has been pivoting all week as people have been not able to join us due to being sick. Okay, Jason's question, ready? And again, we'll look for others to jump in, but Jason, can you share what, in your perspective, are the most significant challenges faced by YSPOR in the Yukon context right now?
Thanks, Tosh. And I'm sure the other panel members have much to add here, but from my perspective, there's at least a few areas I'd like to touch on, and I'd like to hear others' thoughts on this. As with many things, I think here in the Yukon, we lack economies of scale. We're not that large. We like to punch way above our weight, but still, you know, we are small. So diversity and geography. Also, I think, you know, in some respects, there's diversity in First Nations here as well. There's 14 First Nations, all rich in knowledge, rich in culture, you know, and information. So that diversity it can be sometimes a challenge, I think. The second theme I'd probably touch on here is probably data and information. Again, we are rich in data for sure in this territory, but to be able to mine that and turn that information into information that generates knowledge and innovation is a challenge for us. And also, you know, the other challenges are about governance of that information. So things such as ownership and control and access and privacy and whatnot can be a challenge, but something that has to be looked at and overcome. And the last one I'd probably say, and I'd like to get others' perspective on this, but trust in the health system is transitive to trust in what's happening with YSPOR. So foundational to accessing care, foundational to people feeling vulnerable or not, is trust in the healthcare system. And it's a bad day when people don't access healthcare because they don't trust the system. And that can translate into work that's being done sometimes by YSPOR. Trust in how the information is gathered, trust in how they can participate, who owns the information after, who owns that, and even trust in that translating into meaningful change in policy and procedure that ultimately affects care for individuals. So yeah, I think it's, on one hand, I'll say that's a challenge, on the other hand, it's an opportunity, and one that we have to face every day, and one that I would like to continue to progress on. So I'll leave it at that.
Thanks, Jason. Mathia.
Yeah. I think I just want to add maybe to, or expand on some of those comments. When I think of economies of scale or diversity, it is really addressing inequity. So YSPOR is set up to support patient-oriented research. So when you look at how does this body or this entity support our communities? And it really has to be able to address the inequities that we see in our communities. And when I say inequities, it's not disadvantaged or anything like that. It is based on experience. We have some communities that are great at doing community-based research. We have some communities that just don't have that experience or are not interested in it. But we're in the midst of a fundamental shift in the territory where we're moving from a healthcare system which is the antiquated, we know it's not working for us, we saw all the flaws across Canada in our healthcare system, and what we're trying to move into is a health authority that is supposed to have very much an Indigenous voice at the table. When we think of Indigenous pedagogy, the Indigenous ways of knowing, doing, and being, how can YSPOR and the research that is being conducted in the territory really look at bridging that gap between the Western model of healthcare system and an actual patient-oriented, centered approach to care? How do we build that model? That takes research because it's something that we will have to do together. This is not something that we can rely on YG to do by themselves, and it's something that requires a community voice. So how does YSPOR be a part of that journey from the traditional healthcare model where the doctor knows best to something where you actually have dialogue between healthcare practitioners and we integrate? Can you imagine communities where we have midwives in our communities that are Indigenous, that create and birth our children in our communities, and have cancer care or actual well-being care in our communities versus illness care or disease care? I think there's a big shift that can happen, and we can be leading that, but it requires a community voice. So I think that's the biggest challenge, is YSPOR finding the niche in that journey between this, where we're at now, and the vision of where we want to be, and how do we build the strength in community voices? Because that is what is going to change this whole perspective of our communities.
Smith, yeah. Elder Jerry?
Yes, I would just like to add to what Jason and Mattia have said. I think YSPOR has started very well with incorporating the youth and their elders, but it is something specifically in the communities that we have to listen to our elders. We have to empower our youth. Why aren't they getting training in the community for emergency response? Why aren't they getting training in the communities to help if somebody is sick? What do they need? I think that that's one thing that YSPOR is going to have to work on very carefully: empower the youth, incorporate the knowledge from their elders, get some of the nurse practitioners or doctors out to the communities to train these people to be able to help their own people. We don't really need to be importing nurses from somewhere else. We really need to empower our own people to take care of us.
Elder. Dr. Ranaday, do you have anything you want to add on challenges that YSPOR is facing?
I think that because we've talked about YSPOR being sort of in formation, in development, right? That one of the sets of challenges that any organization like that faces when you're starting is like sort of defining and bounding and prioritizing. So I would say those are the three that are really the focus here, is to say, like, can we kind of say this is the work of YSPOR, and within that to prioritize some things, and that's challenging because everybody has different priorities for what they'd like to see come out of YSPOR, right? But to get on the same page about what some of those priorities are, as well as to say, like, let's create some definition and bounding around the substance of the YSPOR work and how it connects to the other spaces that are happening.
Great, thank you. Doctor, I'm just going to ask you to keep the mic there. I'm going to jump around a little bit. I'm going to ask you to speak to, how do you think YSPOR can ensure long-term sustainability and continued growth, given the challenges that we've just heard about, but also in the context of evolving healthcare needs and research priorities? We heard Mattia mention the evolution of our own healthcare system. So how do you think that sustainability can be achieved?
Okay. I mean, so let me link that to like some grand ideas about what could happen, right? So in the grand idea of what could happen, I envision YSPOR as being kind of a critical partner in terms of understanding what the patient-oriented research priorities are and enabling that research and then working towards translating that research into changes in the health care and other systems. So where the real opportunities are, I think, are to say there's like, let's talk about SPOR, and then let's talk about why SPOR. So SPOR, Strategy for Patient-Oriented Research, right, is this like large pan-Canadian exercise in trying to understand what are the things that are important to patients in the system, although we could say what are the things that are important to people in terms of their health, and then how do we actually measure and evaluate, or not evaluate, that's the wrong word, but understand those things, both from a qualitative and from a quantitative perspective, right? So there are common things to being human that we all experience in the healthcare system that everybody wants to know about. Do you feel heard? Do you feel that the system understands you, that people who are providing you with care understand you and your story without you having to tell it over and over and over again? Do you feel that the people in the system make steps to understand what your particular needs are and how they can manage that? Those are things that are common to like the human experience of healthcare. And there are ways in which we can understand how to like understand that across the board and then understand it at the Yukon level. Then I would say, what is important to people here in the Yukon about their healthcare system, about our healthcare system? And not just healthcare, but about the things that deliver health to us. So it's not just about when we're, like, you know, like Matthias said, like not just about when you're sick. What are all of the things that enable us to be healthy before you even get to the place where you have some kind of symptom, right? And can we understand that from the perspective of people in the Yukon and understand what the priorities are for deeper understanding of those issues? Then you make a plan to understand them or do that work, which is research, and then you take it into the system and go, here's what we learned, here's what we understood, here's how you can help change your system based on this information. So that's the grand thinking. I think that like in a perfect world, we'd be collecting things that all Canadians need to know about the health system, but then we'd be collecting things that Yukoners need to know about the health system. We'd be collecting things that Yukon First Nations want to know about the health system. We'd be collecting things, right? And in that manner, then you build kind of this overarching ability to understand the health system, not just from the data perspective, which is like, oh, you had a hip surgery and how long were you in the hospital, but from the person perspective, which is, were you cared for? Did you get the things that you need? Was the care coordinated sufficiently for you? Like those kinds of things, which we can do a better job of understanding. I will stop.
Great. Thanks, Dr. Jason. Somebody who deals with sustainability and an evolving healthcare world every day. Anything to add to what the doctor shared?
Yeah, I mean, probably extending the comments I think that Dr. Ronade is making here, but and probably relating back a little bit to Elder Jerry, who's a strong advocate and champion for youth. But first thing I would probably say is youth, continuing to engage youth, which I think YSPOR has been doing. Real short story for you. I was fortunate enough to get on a plane to come back home late on Monday night. A young gentleman sat down beside me. His name's Jarrett, and didn't know who I was. Didn't expect he would know who I was, but he exuded passion and excitement about YSPOR. And that to me is invaluable about sustainability here. So just the people you're involving is incredibly important. Second thing I'll probably say about sustainability is relevance. We are going through a health system transformation here, and it's not an if, it's mandatory. It has to happen in the territory and across Canada. And relevance of YSPOR means to me that and I think this is a little bit where Dr. Ronade was going. Relevance of the studies and the projects and the activities that are undertaken by YSPOR are really important as far as transformations of this system, guiding where this system should be going, ensuring that youth and that Yukon First Nations have a voice in what's happening with that transformation will be incredibly important. And I think YSPOR is a strong player in being able to inform a lot of those decisions, and it's going to take some innovation. Our health system is under extreme pressure at the moment, and it's just growing exponentially. that pressure is just continuing, and that's where why we talk about transformation and where it's coming. And that's not just doing the same old thing. It's going to take innovation to get there. And again, cycling back to information and evidence to be able to fuel the thought process that goes along with that. So those are my thoughts.
Great, thank you. Mathia, anything to add?
This is the long-term sustainability. I think this ties also to that previous question around significant challenges. With our self-governing nations, if you look at Together Today for Our Children Tomorrow, it does have a section in there about our health system and about leading research. And I think there's a gap here around having these larger conversations. So I absolutely agree. It needs to be community-led, community-driven, inclusive of youth, elder, and people with lived experience voices. And that does help build the trust in order to make programming shifts happen. But this other piece around having this larger conversation with First Nation governments that are a level of government here in the territory, and having a conversation around what are your strategic priorities or your priorities in communities, and is it opioids? Is it response to cancer rates in our community? Like, how are we actually having a larger conversation with the First Nation governments that are a jurisdiction and being able to translate those conversations into that priority setting that Sudit had mentioned? I think that piece around bounding and prioritizing really has to be done with First Nation governments at the table, because that is where our community jurisdiction comes in, and that is where a lot of the shift can happen. I love it when shift happens.
Sorry, she loves it when shifts happen. Just to clarify. Elder Jerry.
Well, after all of these awesome comments, I really don't have much to add, except I agree. The First Nations have to be involved. Their youth have to be empowered. I totally have faith in our youth today. The ones that I work with, that I know, they've done really a terrific job, and they are so passionate and so interested, as Jason mentioned. So for me, that is paramount, that we assist our youth and get them up to the top.
Goodness, jeez. Mithi, I'm going to go to you next. I want you to just build off of this conversation. I think there's consensus on the panel that the First Nation governments need to be involved, that people with lived experience need to be involved. So the next question I'd ask is, how can YSPOR further strengthen collaboration between researchers, policymakers, clinicians, and communities to ensure that research outcomes are effectively translated into policies and practices? And foreshadowing, Doctor, I'm going to you next.
I love it when I get these ones. The how-to. I think there is an opportunity to really formalize the relationship with First Nation governments. If you're looking at strengthening that relationship in order to create change, you have to ensure that there's a strong voice at the table, because who is going to create the policies and create the change? Yes, you need the community voices involved in informing those actions at the community level, but it's actually the governments that make the decisions that change policy, that change the legislation. So you need to have a concerted effort. Like, the vision behind our agreements is a tripartite relationship. We know that the federal government is the one that pays for all of this, pays for everything that happens in the territory. And when we look at the territorial jurisdiction, that jurisdiction is actually shared. It needs to be shared with the First Nation governments. So what does that table look like? And I know there's conversations happening around the new health authority and the governance of that new health authority, but there also has to be a level of conversation around the legislation that's going to govern that, the policies that are going to carry that out. What kind of structures are we putting in place? And it's not visible structures, it's actual bodies of work that are going to be put in place to support the work that is going to be done in communities. When you think of unions that we're dealing with, this is on the ground healthcare practitioners, and how do we actually support and work with those entities in order to create the shift? There is a big piece around creating those community champions. I think shifting away from structures is, how do you support those community champions? How do you build the networks for those community champions to integrate and share, incubate ideas, and really build them up? Because that's where real change happens, is when communities are empowered to look after their own care and to say the things that need to be said in a non-judgmental fashion. When you look at kind of the elements of that conversation this morning, the change that happens comes when people are in we say safe space, but it is really a non-judgmental place. It is a place of brave, honest conversations, as my friend calls it. She's actually trademarked that. So brave, honest conversations is, I'm willing to say the things that need to be said, and look at things from a perspective of, how do we solve these things together? And I think we need to create more of those spaces. And I honestly think that SPOR has a really big role in supporting the creation of those type of spaces. And from an academic perspective, the other piece that could be a big game changer is really integrating with UConnU the opportunity to create Research 101. If we think of training researchers that are coming into the territory to work with First Nation communities, that absolutely needs to happen. This is not Western Ontario. We are matriarchal. This is not the same. So we need to be able to train researchers that are coming in. There needs to be so you want to do research in the Yukon 101, and we need to do a Research 101 for community that is supporting that research that is being done. It is integral to have that happen, because we want to build that capacity. We want to build those champions, and we want to be able to have our youth be able to talk about Indigenous pedagogy and go into any conference and wow people with the knowledge and the experience that they have. Thank you.
Thank you, Mithia. Kluwani women specialize in honest, strong conversations. And you're getting some empathetic nods, or some really good nods from the elders at the table, so that's good. So Doctor, you get to follow that. So just again, our question is, no pressure. How can YSPOR further strengthen collaboration between researchers, policymakers, clinicians, and communities to ensure that research outcomes are effectively translated into policies and practices?
Okay, so agree. And like you said, I think part of that is really formalizing some of the processes that enable that, because that's what we're going to start turning to as this thing builds out, right? That really what's part of how YSPOR is developing is building a way of working, and that way is guided by some of these processes. So getting some of those things, I talked earlier about how I do feel this commitment to get that way right, and I think if that carries on, then the processes can be right as well, because they were built through the right way. And I think that the process doesn't have to be perfect, because you can always come back and make it different or better or what it needs to be. But the way in which that builds out is going to be really important. So getting those ways of working down over the next few years, and getting the ways of doing research down over the next few years. And that, I think, again, with the recognition that nothing is, none of those things, even though they're written down, they're not permanent, they're not unchangeable. They are, but when you start them off in the right way, then you can have the processes to actually look at them and go, is this working? Just like we did at our meeting, are these meetings working? The fact that we have this agenda and we have these very strict time parameters around these things, is it working? And people said, no, it's not working for us. And so actually there's been a lot of changes in the way that our meetings are run. And similarly, when you start off down that path, you build a process that you can change over time, but you've done it in the right way. That's the first thing. The second thing I think I would just tag on to this thing about brave, honest conversations is that, and it's something I mentioned like a few months ago at a conference in Toronto where they were talking about, how do we bring more partnerships in healthcare. And I would just say that it's kind of like, it goes back to the stance of how you see yourselves and your relationship. So brave, honest conversations, right, can only happen if you're also committed to coming back, because you're going to have disagreement after them. And how do you manage that? How do you handle that? How do you sit with it and then come back and go, I know that we disagreed, but Yeah, essentially, right? Like, so that you say, but we're still part of this family. We're still part of this relationship. And so we're going to sit with this disagreement. We're going to come back to it. We're going to keep talking about it. So you have to, in order to make the space to have a brave, honest conversation, you have to say, it's okay for us to leave this table and not agree, but we still respect each other, or we still care about each other. And we're going to come back to the conversation. We're going to come back to the table.
Great. I really appreciate that notion that when we're making these systems changes that are happening, it has to be anchored in relationship because of our complex landscape. Elder Jerry, just anything you want to add on collaboration?
Just one thing I wanted to add. I sure like this phrase, brave, honest conversation. That's a great phrase. I think that YSPOR has the capability to bring everybody to the table and get us moving forward with what we need.
Jason.
Yeah, quickly, and again, just to extend it on a couple of comments that have already been made, but strengthening collaboration. I think YSPOR definitely, I think, is known by everybody that creating capacity and capability in researchers and studiers is important. But I think YSPOR also has this incredible opportunity to create that capacity in people with lived experience, people, patients and others to engage. So, creating those forums for that multi-way engagement is really important. And I think YSPOR is a leader and can be and should be a leader in creating that capacity amongst not just researchers, but others, so that everybody can be in that space and do it in that honest and brave way. And by the way, I've seen that look from Tosh many times, that one that's like, I love you, but she's given me that many, many times. The second thing I would say is, and this may seem obvious, but forums like this, disseminating and sharing information, is incredible as far as getting the word out and creating momentum and capacity. And not just big forums like this, but often and regular communication. It's almost as if you're branding YSPOR and saying this is what YSPOR does, so that more and more people know what it's about. And that creates, I think, obviously awareness and trust. And then one other thing, and again, this may sound very tactical in nature, but looking for those organizational champions that will lead, pick up and lead the change that's necessary. So an example would be my organization, so Yukon Hospitals, working in partnership on certain elements, maybe studies in traditional foods or traditional medicines or things like that, learning from that and then bringing that forward. And I think YSPOR has a unique opportunity to be that conduit, that trusted partner, and that should be almost like a vision of YSPOR, to be that trusted partner in that world. So those are things.
Thanks, Jason. I agree. I don't have a poker face. My eyebrows give me away for sure. So as soon as I have that look, everybody knows. So just moving in, I've heard a number of you talk about capacity and also the importance of the role of folks with lived experience. So my next question, and I invite anybody who wants to jump in on it, is what role do you see YSPOR playing in building that capacity and being a champion for involving, and I'm gonna preface involving with, in a good way, involving in a meaningful way, people with lived experience and at every stage of the research sort of process. Anybody want to jump in on that one? Feel really confident? Doctor?
Okay. I mean, this one's really hard for me. So I might be doing a little bit of thinking out loud here. But I think fundamentally, every person, almost every person, has some lived experience with respect to the healthcare system. Right? So that's important to acknowledge, because we talk about lived experience as if it's this one thing, but it's really many things. So everybody has their own individual experience with the healthcare system, but groups of people have experiences with the healthcare system. And so we need to now start thinking, when we're talking about lived experience, are we talking about the lived experience of specific groups of people in the healthcare system? Are we talking about the lived experience of people with a particular condition in the healthcare system? Are we talking about the lived experience of even people who work in the system, right? And how do we take those things and collectively understand them, as well as thinking through an individual's experience with the healthcare system, because that's an important piece too, right? So there are ways to tackle this from like a research perspective to understand them, and then to use that information to put into the system to say, hey, here's what we heard about diabetes care from people who have diabetes. But that's a subset of here's what we heard about the experiences of the healthcare system among people who use the healthcare system, right? So if you can kind of really put that together as a picture, then when we talk about lived experience, we can be more specific. And we can say, okay, in this situation, when we're looking for lived experience, we're looking for these kinds of lived experiences because the focus is either the disease that we're talking about, or the group of population that we're talking about, or a community that we're talking about. And then you can be a little bit more yes, yeah, thank you. Yeah, a little bit more discerning and directed in terms of where you put your efforts. So that's kind of how I see how lived experience works its way into the system. There's this other piece too, that when you're designing a system, as we're starting to design a system, that you then take a broad view of lived experience to help you understand how the system should be designed. And so it's those two pieces, like how's it working? And then when we're talking about designing it, how do we take those things in?
Thank you. Thank you, Doctor. Any other panelists want to jump in on that question? Building capacity around lived experience and inclusion?
Yeah. It was mentioned earlier that data, access to data, when you think of the principles of OCAP, ownership, control, access, possession, how does that translate? So yes, collecting the information or building the networks is extremely important, but how do you translate that information and be able to integrate it into systems change or shift change? It really is an access to data issue, because people don't know there's a problem. You can have these anecdotal challenges that are faced in your community, but until you come together and have that conversation with other communities and you share data, then you know, okay, this is an actual challenge that we need to address, and we need to create some systems change around, or create policies around. So when we look at the access to data, that is a fundamental challenge. When we look at, in our small jurisdiction, and I know we've had these conversations a lot of time, Laura, we've had these conversations before around the availability of data in a small jurisdiction. And there are a lot of challenges with that, but we need to get over ourselves and look at how do we remove the barriers in order to make data accessible so that there can be change. Because when we saw, through COVID, it was very, when we started sharing the data of cases, of case deaths, those are the type of data points that actually create behavioral change in people. When they start to see that, oh, the case counts are going up, I need to take steps to protect myself and my family and my community. I live with a vulnerable elder. I have children in my household, and I need to take these precautions. It's the data that becomes the impetus for change. So we need to really take that perspective, and I feel like that's a gap that I don't know if YSPOR is the one that addresses it, if it's the territorial government, or if it's all governments, or how do we make it more accessible, transparent, and that information that was shared this morning on BC's data, the coroner's data, is fantastic. But they have a large population. How can we emulate something like that here that shares information about, we've got a syphilis outbreak. Where's the public data on that? I mean, you do press updates on it, but we need to be able to share data in a way that is gonna create behavioral change. And I think that's really a key element that we need to be talking more about.
Thank you, Mithia. It takes a lot of skill to work in data sovereignty and a syphilis outbreak into one answer. So appreciate that. Elder Jerry or Doctor, anything to add on that before we jump to our next question? You good? Okay. So here's your shout out for community hubs and folks online and those in the audience. I'm going to ask the panelists to chime in on one last question. And then the challenge is for you to ask any questions that you have for the panelists who are all involved with YSPOR in different respects. And for those of you online, this is your chance to get your big juicy question in there. So we've got Jesse and Stephanie over there watching for your questions. And hubs, of course, if you have a question, enter it into the chat and we'll be able to put that on there. Give you a few minutes to do that and digest it. So panelists, this question wasn't on your prearranged sheet.
Awesome.
Yes. So my question to each of the panelists is, and I'm hoping that we can start with Jason and work our way down, is in the next 2 or 3 years, what are 2 things that you're really excited and want to see SPOR accomplish?
Oh, gosh. I knew you'd pick on me with that one. I think it's been commented here already that SPOR is not necessarily an infant, but still in its growing stages. And I'm excited because when I look at YSPOR versus SPOR across Canada, so YSPOR being a unit, it's an incredible unit here, and I would stack that up well above any other SPOR unit that I've looked at. The people that are engaged, the people that work for it, the people that are overseeing it on the oversight committee, it's an incredible, unique, I think, organization that is extremely well positioned in the Yukon to be Yukon specific and carry interests of Yukon First Nations. Not often do you see organizations pulled together like that. And what I'm excited about, it's like, if I give you an analogy of YSPOR is about frameworks and networks and communication, and that will build confidence, but it's like building a house. You can build the best house in the world, but until it's inhabited until a family lives in there, it's not really a home. And I think I'm excited about YSPOR because they are creating a great home for patients, for people with lived experience. And I think over the next couple of years, my vision anyways for YSPOR is it will be that trusted facilitator for the collective of those people to get together, youth, Yukon First Nations, people with lived experience, oftentimes those are all the same people, but, to be in that home and call it a home and be very comfortable about those brave and honest conversations. So I don't know if that's 2 things, but I'm pretty excited about where YSPOR goes and how it can be a leader in influencing where healthcare goes in this territory. Earlier I said that, economies of scale was a challenge, but in a lot of ways, our closeness of people here makes it very achievable that we can make really good changes and do them in a relatively quick fashion that makes a difference for people and the care that people receive in territory. So that's what I am excited about is, from inception or thought or, to actual impact to people is really tangible for us. So.
Great. Thanks, Jason. Well done for being put on the spot. Doctor?
I think I need thinking time. So
Mithia will be able to just go.
Okay, 2 to 3 years. I think I'm excited about this potential or the opportunity to integrate that lessons learned or the voice of community into the fundamental shift in our healthcare system. So for me, that's the most exciting part of it. And I think that 2 to 3 year time frame is doable. It is very much within the realm of the possible. And that's really our opportunity. How are we going to integrate our community voices into this new healthcare system? How do we incubate the ideas of bringing community healthcare home? How do we have that voice integrated into those policies? And I think that for me is the most exciting piece. I think there's also, YSPOR has really gone into the Indigenous healthcare realm. There's also another national network called the NEAR network, and it's about Indigenous health research. And it is kind of the equivalent of a SPOR unit. And I think there is an opportunity to really look at incubating a NEAR network here in the Yukon and building that up and really strengthening those Indigenous voices and integrating Indigenous pedagogy into a healthcare system that is a very Western model. How do we shift away from fixing disease to actually creating wellness? And that to me is an Indigenous pedagogy. When we look at building and treating people from a whole perspective, that is what we need to integrate and just disseminate throughout our healthcare system. And I think that's the biggest opportunity in the next, 6 months, 2 years, 3? Yeah.
Sure. Elder Jerry?
So I'm going to leave you with the same quote that I did last year at the summit. And it is from George Davis Deschiton, 1981. It is from Tlingit Yukatangi, The Book of Tlingit by Lance Twitchell. And that is, we have given you a box of wisdom. Now I want to see what you're going to do with that box of wisdom. I'm going to shish.
Challenge laid. Mm-hmm. Doctor. Good? I know we keep putting you in these... Very graceful. Okay, thank you, panelists. That was really good, and I'm super honest. I like honest conversations. So I'd have told you if it sucked. Okay, audience. Oh, my friend Bronwyn, it's so good to see your smiling face. Yes, we've got a question over there, and I think I heard we have a couple online. So we'll go to the person in the room first, and then I'll turn to Jesse. Davida?
Just while Davita's bringing that, I have to plug because Brave Honest Conversations is actually trademarked by a friend of mine, Stephanie Roy McCallum, who actually facilitates these types of really challenging conversations. So if you ever want to learn more about having and holding Brave Honest Conversations, Stephanie Roy McCallum she calls herself Chief Storm Rider, and she's written a book. So there's lots of wisdom in there.
Hi. I love this conversation as someone who's passionate about community well-being. And I think one piece that I'm missing that I think needs to be made visible is transparent accountability. Because if we don't have a built-in piece for this accountability that we make transparent for everyone, then we cannot really see where we dismiss people, where people feel not heard, where people feel not be included, but we're also not measuring success. So I think that is extremely key, this transparent accountability. That's my little 2 cents, but awesome.
Goodness, geez, thank you. Any reflections on that comment? Accountability, transparency? Everybody agrees?
Yes.
Lots of nods. I think it's a good point. Oh, and thumbs up. Thank you. I'm going to go to a question online. Then there was a person who came up to the stage earlier who, oh, perfect. You're already ahead of me. Okay, let's, David, if we take a question online and then I'll invite.
Yes, they're going to go live to
Oh, we're going live to Old Crow. It's exciting.
Hello, hello.
Hello, Old Crow. We can hear you.
Yeah, so this is Wilberforce, Wanogaba. has been a research professional with SPOR and continue to be one. Thank you. Today the highlight is on YSPOR and all the activities that is going on, which is great. But YSPOR is just a subset of what now inevitably we are getting into the discussion of the health systems overall. I'm glad Dr. Renre brought it up in different dimensions. One of the issues that stands clear to me is this idea of knowledge translation from research to actual policy, actual work within the government. As we move forward the transformation, there could be some assurance or some more comments around that, because I think that has been more or less like a barrier itself. And then the other thing too, the health systems really, when we look at it, again, the doctor touched a little bit on that, is really so comprehensive, because when we talk of experiences, sometimes we forget to talk about the providers themselves. What are their experiences? Because there's a very big part that they play for proper health system transformation. All the experiences that we talk about gets down to what was your experience when you received care, how were you treated, and gets down to humanity of the health system. So my question is, I guess, is to do with the actual work that would be really done in terms of behavior change, maybe basic training for health providers and all the approaches as we get to the health authority. If the doctor could have a touch on that, or any other person, the approach that would be there, so that the transformation goes the way some of us think about it. Thank you.
Thank you for the great comment and the question. To see if there's any panelists who want to respond. I think what I heard in the question was, how do we what is the actual work going to entail to build up these pieces so that policies can be put out the way they need, that action piece that's there. Thoughts? Doctor, I see you nodding.
I mean, to me, this goes back to like creating the processes that let you do that. And when you don't have them, then you hit a bit of a block because someone goes, hey, we've got this stuff. We just learned it. We think it's really important. And then what, right? So you have to build these processes that allow for essentially like a learning organization to exist, where you're saying we're actively taking in this information, we're going to say this is what we're going to do with it, or this is how we're going to understand it, and then these are the things that come out of it, right? So you can build a knowledge translation process into a health system, but it is still a process that you need to actually sort of say, this is how that works. This is how we're going to take in information, this is how we're going to share it, and this is what we're going to do with it.
Great. Jason?
Yeah, really quickly, I think I mentioned this earlier, but bringing those partners together early in the process so that they're engaged. So, you know, knowing what those outcomes are at the end. And, you know, I will be the first to admit, as an example, that, you know, as an example, hospital systems extremely obviously Western-based methodology in care, and that it's a real struggle for people within that system to integrate and look at new and different ways of caring for people, including traditional knowledge and traditional care practices. But having said that, I think there is an opportunity here through mediums like YSPOR to ensure that changes and that can improve care for people in the Yukon. It's just a matter of, as I said, engaging people early on. And there was a comment about accountability earlier. The information, the study, the evidence, it's not owned by, say, the hospital. It's owned by people. And that accountability is about what people want in their care. So it's incumbent upon organizations like mine to find ways and look for people like YSPOR to actually give a kick in the pants to organizations like mine to improve the way that care is provided. So I don't know if that's bold enough for you, but those are my thoughts.
Yeah, kick in the pants. I like it. It's bold. Great. Thank you.
Okay, we've got another question here on the floor. You bet.
I'm having this in the stand, excuse me, because today's health issue involves tremors, so holding the mic is a little bit of a problem. I'm just speaking from the person with lived experience and wanted to kind of talk about some of the sustainability and capacity that was mentioned up there. what I'm finding and looking forward to what's going to be next with YSPOR, because I've been involved for a couple of years now, and that is a little bit more networking with our group of people with lived experience across the various places in the communities. One of the things about being a person with lived experience is you're kind of in a silo yourself, and then you might find there's something going on or you're getting a call about a project, but you're a little bit removed. And I did have an opportunity, Michelle helped me set this up, with a group in Quebec of people with lived experience. Some of them have been involved in research projects, others were considering it, and it was kind of like a noon cafe thing, excuse me, and there was virtual connections too. And I just found it fantastic because sometimes you think, is my story relevant? How am I helping? What is the project? Also with lived experience, some days are good days and some days are not so good days, and some days are in the basement mental health days. But all those experiences are relevant, and we want to participate because we want to see changes in the healthcare network. We want to do our part. So I'm thinking some kind of a connection, and the YSPOR staff could help with this, throw it out a couple times a year. And to the various people with lived experience, the elders, I'd like to hear more from the youth too, what they've been involved with, hear the stories, share, and I think we give confidence to each other, and it's our chance to ask questions. I know in the one that I participated in, there were lots of questions to those who had participated in research projects about, well, what did it involve, and what was expected of you, and that kind of thing. So I'm just looking for more support for the people with lived experience going forward, and then we're going to be a network of supportive people that are going to help convince other people, yes, your story is important, your sharing is important, and we can make a difference. I'd love to sit down with Jared and hear all about his experience too. Anyway, I don't have a question, I more wanted to put it out there and see if that was some of the things you guys were looking at for capacity and sustainability.
Great, I think that was amazing and incredibly valuable. Anything you're good? Yeah, go ahead, Jason.
I couldn't agree more. As far as, I use the word confidence, like when you build the network, when you build the connections, it then generates confidence that it can actually make change, and then that generates more and more energy and enthusiasm and trust. So yeah, I couldn't agree more, but that's, just restating what was already said.
Thanks, Jason. And I think there's a question here.
Two more from the floor. I feel like I'm very this side heavy, so if anybody over there is interested, also just raise your hands.
This side's kicking your butt, people. You got to get some questions out.
Hi there, it's Maluk again. I want to reflect on, somebody had said that we have to trust the healthcare system. Speaking from lived experience and going through my opiate addiction, I was just put in the psych ward. I had no faith in the system at all. And all I felt was judgment from the nurses and from the doctors, and there was no support in trying to heal from the opiate addiction. It's very discouraging that I was just thrown into the psych ward, and I've talked to many, many, many people, and they feel the same way. So how can we go about trusting the healthcare system?
So panelists, response on how you can build trust with the healthcare system? Mithia, I saw you writing something down.
I mean, for me, trust is not something that you just instantaneously have, especially if it's been eroded previously. I think there are so many elements to building trust. When you think of establishing a new friendship or a new relationship, you don't immediately trust those people with your deepest, darkest secrets. So you don't automatically open up and share everything. So how do you build trust in a relationship? Because really, your relationship with the healthcare system is what is being discussed here. How do you build that trust? You build it through having conversations that are non-judgmental and that are actually supportive, empathetic, and that you feel heard. That is the biggest piece of establishing trust. So in order to build that into the healthcare system, what does that take? It takes staff in the healthcare system, healthcare service providers that are not exhausted at their wits' end, dealing with multiple traumas. They have to be able to have some fuel in the tank to be empathetic. So there is some fundamental shifts that need to happen. How do you do that? So when you go work backwards, how do you do that in the healthcare system? And that's a question. Right now in our healthcare system, our healthcare providers are exhausted. How are we expecting them to show up and be empathetic and create systems change if they're not getting their tanks filled? And that piece about transparent accountability, when you know that somebody is, you don't build trust immediately. You build trust by people doing what they say. So when you have an empathetic ear, you've shared your experience, you've shared your lived experience. If there's not a mechanism to translate from your lived experience and the information that you're sharing and that translating into action, there's going to be that just breaks trust right there, because you are being vulnerable. You're sharing your experience. You're giving your time, your experience. And if that doesn't translate into change, then you've lost credibility. The system has lost credibility because they're asking for your experience. They're asking for you to, your input in systems change. And if it doesn't actually change, then there is going to be no trust. Fundamental, that's going to break trust. And how do you build that? You build it through transparent accountability. You say, we heard you, this is how we're going to integrate what we heard, and you can measure us on that. And that takes time. It doesn't happen overnight. And so when I say the shift from our existing healthcare system the way it is right now to something that is fundamentally different, that is patient-centered, there's a gap there that needs to be addressed and needs all of us to be working on. And how do we build those systems? It is the framework. It is the tables that have the people's voices at the table to create those systems change.
Thanks, Mithia. Right? Doctor?
So I agree. And I would also say that I think it also comes down to sort of reframing the purpose of what we're trying to do in the healthcare system, right? And so often what we look at in terms of whether or not we did the right thing is you had this and therefore we did this. Do you know what I'm saying? So it's like, oh, there's this diagnosis or this code and therefore you were given this kind of treatment. And some of the reframing is really more about, are we helping you? Are we doing what you needed from this? And that may or may not be related to you have this and therefore we're doing this, but much more about what do you need from us right now and how can we do that? Sometimes systems are not set up to be flexible enough to accommodate what an individual needs, and we have to do a little bit of managing that, right? But at the core of it, I think it's really about making sure that we go back and ask ourselves, did we help you? Did we help you in the right ways? Not, did we do what is the right thing to do on paper because of what we wrote down of your diagnosis? So that is a process. We have to get there. And I think that there's a lot of, like you say, conversation and there's some work throughout that, and you can do it on some level by adapting the process by which you monitor, but you also have to shift a culture of how we behave in healthcare to sort of saying, our goal is at the end of the day, did we help you, not did we give you, you have to give, you have to do a bit of both, right? It doesn't make sense if you said, oh, you came in with diabetes, so I gave you this cholesterol pill. Like that doesn't, like it's you still have to, manage what you're seeing, but there's this other element of we have to be asking ourselves with each person that comes through, like, did we do what you needed in the time that we had with you? Did we make the space for that?
Great, thank you. Jerry, something quickly?
I just wanted to add something that I have been advocating for a long time, and that is especially for my First Nations brothers and sisters. I would like to see in Imaluk's case, why wasn't there an elder present that could have either explained or assisted in what are the cultural and traditional ways? How can we help her explain her story to the medical people that are there? I know there are instances where everybody, especially patients, have the right to an elder to be present. And this is something that I'm advocating for, and I will continue to do it so that you get the best care that under the calls to justice you are entitled to.
Cheers, Jerry, thank you. Davida?
So we have a series of questions coming about. I have one online here. I think we have Lorraine and then two that are out on the floor.
And then we're going to break for lunch.
And then it will have to be exactly break for lunch. So online, we have a question coming from Dylan. So coming from an academic hospital setting in research, how do we integrate Indigenous communities' voice in clinical research trials? Who needs to be involved to make sure this is a culturally competent process for Indigenous patients? And is a fluid knowledge translation process best practice when developing research trials?
Great question, Dylan. Way to sneak in like 4 questions in one. Going to ask panelists to do your best to answer a little bit of that. Anyone feeling like they want to go first on that? Jason?
I mean, that's a huge question right there. There's a lot, and I'm only going to touch on one piece, and I think it's quite obvious that, Yukon First Nations are the leads here. And, when you undertake research and study and information, Yukon First Nations should be in the lead and should be in control of how that proceeds, whether it's a formal academic institution or not. I mean, that's a basic premise of proceedings. So,
thanks, Jason. Mathia?
That was a loaded question. I started thinking about right away at the beginning of that question is how are you designing your surveys, your methodology? Is it being designed with First Nations voices at the table? I think that's a fundamental question in any research that's being done in Indigenous communities, so that you're not asking questions in a way that is offensive or it is just not acceptable. There's that, and then. I don't know. I got stuck on just creating the right process, I think, at the beginning and starting off right. So having elders as part of your research program, having a youth voice, really looking at how are you building those champions in the communities. I think that is one of the biggest pieces of doing research right in our communities.
Great. Thank you, Doctor.
I think that the last question that was asked actually is the key to sort of all the other questions, right? Which is that fluidity in the process, and to what extent is that fluidity accepted and enabled and encouraged, right? So this is where I think it comes up against these sort of very rigid paradigms of how we do things, right? And so if you're like, oh, I have to build a knowledge translation plan. Okay, so somebody's expecting this by tomorrow, and so I better sit down and just go, blah, 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 blah. Here's my knowledge translation. Here are all the things we're going to do. Well, you missed out on a critical piece, which is talking to people, understanding what the purpose is and all of that stuff. But sometimes the timelines that researchers are under, or the needs of the funders, or those kinds of things can actually come into a little bit of tension with what people try to do when they try to do all of this work together with people, which actually is messy and it takes time and it takes, right? And so I think there's a growing recognition that in research that involves communities, that there needs to be that fluidity. It's how do you then incorporate it into the protocols and the things that you actually have to write up about, right? There's a bit of that, but it's not, it's a slow shift. It hasn't happened to the way I think that, like, there's some people who really get it and there's other people who are still working towards it, I would say.
Great, thank you.
Van Quincy, thank you so much. I just wanted to make a comment, and what a wonderful dialogue about hoping for the future for our healthy communities. Still shaken by the information regarding the opioid crises and what we're dealing with in the Yukon earlier. And this brave young lady here sharing her experiences is really helpful. And it's very emotional when we're talking about the health of our families, health for our communities, and how we're going to bridge that gap and try to move to a better tomorrow. And having those discussions now. And I'm just thinking about time. You know, time is of the essence. Our young people are dying. You know, as a mother and a grandmother, mothers and grandmothers in our communities, it's like, when do I get a call? When is it my turn to get that call? Who do I turn to? I come from a small, isolated communities where trust is next to nothing, where politics plays a huge, is a huge issue in everything that we do in our everyday life. Our young people, elders, perception, you know, is huge, and we're coming to a place, I think, in our life, our reality today is, you know, trying to have hope in a hopeless kind of situation. I know I'm sounding really negative, but that's a reality that we live in today. I just wanted to really make a point here that we are dealing with burnout in the health, you know, in the health fields. We appreciate everything that they're doing, but our healthcare in Canada is in a crisis. When a young person can't even get a doctor to see to make sure that they're addressing their opioid crises, and keep every time they knock on a door, it closes because there's not enough there or nobody that understands them. And it just goes on and on. I just wanted to really make a point that, you know, First Nations people in this country, we have to deal with NIHB. You know, and it's traumatizing all over again. And, you know, a very colonial system that we deal with. And in our communities, when you have to travel for medical, it just becomes all that more important and urgent. And especially if you have to travel on to Vancouver and those places to have healthy, reliable escorts and someone who's going to take care of our elders, our knowledge keepers. So that would be, I think that would be one point that I would like to recommend, is have someone from NIHB sit at all these circles. That's going to make, or try to make a difference for our people, because we're constantly, our families, our people are constantly, being frustrated while they're sick and need care. And so I just wanted to make that point. Thank you so much, Masicho.
Masicho, thank you. And those were really important points and some big topics and some big pieces that we can make sure or we're advancing. I recognize that we've got one or two more questions. We can't not take the questions because we called out this side, so both the questions are from this side. But then we've got lunch coming, so I'm going to ask the two questions on this side, and panelists, just to keep your response short and succinct. Ganesh. Oh, well, that's more from the middle.
Hello. Hi, everybody. I'll just keep mine short. I think it's really interesting when I hear the different perspectives and what people are saying. And I think ultimately, all of us can agree we just want to be healthy and happy and well. And that's genuinely something we want for ourselves and for everyone around us. And I think the way our system is set up, and the doctor there mentioned that, is there are policies, and on paper there's this box you got to check and these things you got to do. And then so people that are checking the boxes and doing, they're checking the boxes and doing because that's what they've been trained, and they have their own view of the world. And there isn't space for like the ego and letting down the ego and having more compassion towards each other. And I think that the healing and wellness really comes from being able to have an open heart and see people for who they are, regardless of their education, background, socioeconomic status, whatever they've lived through, and just be there for them. And just really see what they need and perhaps ask them, what do you need? I had more to say, but I'll keep it short because we're hungry. So, thank you.
Last question. Oh, we only got time for one more, and I think they've already picked, but I appreciate the effort.
I just wanted to bring up, last year at the SPOR conference, we did recommend some things, and I haven't heard that being spoke about on this panel. One of the things that we recommended to the chief medical officer at the time, Dr. Brendan Hanley, was that we actually do some basic Northern and First Nation 101 with the doctors and nurses here. We do have a lot in our First Nation community that actually go into health centers and go into, even myself as an educated professional going into Emerge, they actually ask you, do you have a problem with alcohol automatically? Are you fearful to be at home? Did they ask all people that? I don't think so. I think they only asked the First Nation population those questions. I've actually had family members that have gone in and they're self-medicating. So they're actually going in intoxicated, going into Emerge for help. Oh, you're just a drunk, so we're not going to help you. Later on down the line, that person has stage 4 cancer. This is not only in our community, this is in all communities across the Yukon. So I just want to make those concerns brought up. I know that it is a concern. We need to change the persona of the healthcare system and how we're helped. We also have a shortage of doctors, so people are stuck with doctors that don't listen. And that's also a struggle. Like, we don't get to change or, say that I don't like my doctor, so I don't get to go and, choose another. And that they're not getting the help they need. So that's actually helping, that's actually happening in a lot of our communities too, is because our doctor's not very good or our doctor doesn't listen, so we're not getting the help that we need. So, or they're dismissing what's actually being said. So they're not being listened to as a client. And I think that we're also trying to, in our community, and I think this needs to happen more, and we need some more funding for it, is we actually need health navigators. And I mean that, and I've also been this person as well for my family, where I go in with the family member to the doctor, and then the doctor goes and tells the prognosis and says everything that was going on. I've been in the health field for a long time, so I can kind of get the gist of what's being said, and then I go back and I go and tell the family member in layman terms so that they can understand what's happening, because they don't get it. They don't understand what's happening. And I think that's a lot of like our clients. They go in,
they're with blindfolds, they come back out and we ask our family member what happened, and they're like, oh, they don't tell us what the doctor said, right? So those are just some concerns I have, and I really still want to advocate for the 101 for our newcomers. We have a lot of influx and lots of new doctors and lots of nurses, and yeah, they need to know the Northern First Nations community.
Goodness, Chief, I just wonder, Jason, if you want to quickly touch on some of the work the hospital's doing around that training for nurses and physicians.
Yeah, no, first of all, thank you for that and those comments. It's, whether you realize it or not, it's music to my ears, and is something that's definitely a journey that as part of the health system, the hospitals have undertaken. One of the challenges we see is that we have a lot of, I'll call them itinerant staff that come through, whether it's nurses, doctors, they move through, and that's a changing demographic of the healthcare provider environment that we have today. And part of our role is to make sure that people are, that I'd like to see them be better equipped in the environment of being culturally safe and humility in the environments they have to work in, oftentimes in smaller communities. And so we've definitely undertaken a lot of work, and will continue, because as I said, it's a long journey, to provide education, to provide experiences, to ensure that those healthcare providers that are so burnt out already feel supported in the environments that they're in. And we're actually doing it in partnership with Tosh and Davida to see if we can improve that environment. There's no doubt that our system itself, it's fraught with discrimination, racism, provider-centric care that I would say doesn't listen well and doesn't respond well. But that's something that we want to change. So right down to the basics of having nursing education that we've tailored specifically to nursing that can be administered, and even if somebody's in the community only for a few weeks, it's still incumbent upon us to make sure they're supported and equipped to do that. So not, if I had a magic wand, I'd wave it a whole lot more, but it is a journey, and it's something that's very important to us. So.
No, she's Jason. Doctor, I'll absolutely let you comment, but just know you're between this group and Meatloaf.
Okay, then super fast. And this is not the be all and end all to the answer. I would just say that one of the things I do know is that all medical practitioners who seek a license in Yukon are required to take. There's a Yukon First Nations course that was developed by Yukon University, I think, in partnership with Yukon First Nations. I'm not sure, but there is a requirement that course be taken. So just so that, like, for people who are applying for a medical license, that is I don't know when that requirement came in, but it does exist. So just so that you know, I don't mean to imply that taking the course is right. Like, there are still going to be things that we have to work on in terms of people's culture and how the system handles, like how the system works with patients. But just so that you know, there is that one thing, and I only know because I when I was applying, they said, oh, and you have to do these things, and one of them was the course. So
thank you, Doctor. They're laughing because Davida and I built the course.
Oh, awesome.
That's why they're laughing. But we'll say that Yukon University still runs it, and I'll just take the opportunity to say Yukon First Nation 101 was meant to be a beginning. Yeah. It was not ever meant to be the sole silver bullet, and there needs to be a lot of progression on that piece. So, can you give me a hand in welcoming and thanking this amazing panel? That was